what's up guys? Nina here from Pork Roll and Eggs. Today, I am at Associates in Dentistry at their Seager location on Highway 35 for my Zoom whitening treatment. I'm so excited. I cannot wait for these teeth to shine. So let's go on in and see if we can get these chompers to really sparkle. Hello there.
I'm Kathy.
Hi Kathy. This is Kathy.
Going all the way to the back.
Hello, Nina.
Oh, this is Dr. Steiner. Hi, Dr. Steiner. It's so nice to meet you.
Nice to meet you.
Thanks so much
for your Zoom treatment today, right?
Yes, I am. Thank you for having me.
Do you did you do any research on how the system works, or do you have any questions about?
Not too many. I didn't do too much research, but I did hear from a coworker of mine at the station that he had the Zoom whitening. He's very happy with it.
Good.
Just told me a little bit about it, that there's a laser involved, but that's all I know. So tell everybody else out there like me who has no idea what's going on.
This is our laser lamp right here.
Okay.
Let me get this up in the proper position here. Basically, what we have here is called Zoom Advanced Power. Zoom is made by Discus Dental. Zoom is, the Advanced Power is our third generation lamp. The most powerful one on the market today. Zoom came out, the product Zoom came out many years ago, probably about 10 years ago. It was just called Zoom. They perfected their product, which they thought was perfect, to Zoom 2. And about a year and a half ago, they came out with Zoom Advanced Power now, which is their third generation. So you can't get better than this. Better than any other Zoom product out there, better than any other Bright Smile product out there. It has the best results. Basically what we do is we isolate everything, which means your soft tissue, lips, gums, cheeks, and that kind of stuff, so the lamp doesn't burn or cause any damage to you. We apply a whitening gel. The total treatment is 45 minutes. During that 45 minutes, we're going to be changing the gel a couple of times. We set the timer for 15 minutes. After 15 minutes, we'll come in, we'll remove that gel, put a second batch of fresh whitening gel on there. We do that a total of 3 times, and there's your 45-minute treatment.
Wow.
At the end of the treatment, we're going to apply a fluoride treatment for about 10 minutes, and that fluoride treatment is to help with any post-operative sensitivity. Any whitening product can cause some minor post-operative sensitivity. It doesn't happen in everybody. It does happen in some patients, though, and this fluoride treatment is to help with that. If you do experience any sensitivity afterwards, it's gone within the first day. So by tomorrow, if you do have any sensitivity later on today, it should be perfect. Doesn't cause any damage to your enamel. The reason you have sensitivity would be because the enamel becomes dehydrated during the oxidation process of the whitening. And once your enamel becomes rehydrated, all the sensitivity's gone.
All right.
All right.
All right, so I think I feel comfortable. I'm not scared anymore. I was a little nervous, I have to admit. I've never done a whitening treatment before, so this is my first time, so I was a little worried.
Very good.
But not anymore.
Are you ready to start?
I am ready. Let's do
Okay,
this.
let me sit you up here. First thing we're going to do before we do anything is we're going to pick a starting shade. And that starting shade is where your teeth are right now. And it's a reference point for us to compare at the end to see exactly what kind of result we got, okay? The manufacturer, Zoom, guarantees a visual shade change. However, they don't give you a guarantee on the number of shades. Some patients that start lighter don't have as noticeable as a result of somebody that has darker teeth. So shade change can range anywhere from 1 shade lighter to 5, 10, 15, 20 shades lighter. Everybody's different and the results are different. Alright, so your starting shade here is 130. And I know that those numbers don't mean anything to you, but that's the color. We're going to keep that up there. And use that to compare later on in the appointment, okay?
So Dr. Steiner, is that the color that my teeth are at now?
That's
or
the color
is that
your
what
teeth
we're
are
going
right now. Okay, so that's the shade that you're at now. To answer your question again, when we finish, we're going to hold that shade back up to your teeth to see what kind of results you got.
All right.
And we will also pick your new shade, which we're probably going to end up down here in this little bleaching shade tab, which is not included on that because most people don't have teeth that light unless they whiten them.
I was going to say, I'm not going to look like Pat Healy in Something About Mary, right?
I don't know. I'll try my best. We will see. All right, so you're ready?
Yes, I'm ready.
All right, it takes us about 10 minutes to get everything set up here. And what I mean by that is we're going to be using some cheek retractors to hold everything out of the way. Like I said, we're going to be using lots of stuff to protect all your soft tissue. We're going to have a napkin that goes around it to protect your cheeks and stuff.
Okay.
I'm going to be applying something called a liquid dam to your gums, and that seals the whitening gel from contacting your gum tissue.
Okay.
The liquid dam is a liquid, hence the name, and we flow it over your gum tissue. Kathy's going to shine a lamp on it to harden it in place.
Does it hurt?
Does not hurt. is going to beep when there's 3 minutes left. 3-minute warning, I call it. And then there'll be a longer beep at the end of that 3 minutes, which signals us to come in and change your gel, okay? Okay. Before we start, what we want from you is to get you comfortable. So do you want me to bring your chair up at all? Keep it back? Up? Tell me when to stop you, when you're most comfortable, and I'll get the headrest adjusted for you. You good like that? Headrest okay?
Yeah.
Alrighty. You alright like that?
Yeah.
Very good. Alright. You're off and running. We will see you in 15 minutes to change gel. Alright? Good.
All right, so we are all done with the Zoom whitening treatment. See, now, Dr. Steiner, you have the fake teeth, so you guys can actually see the difference from before. My teeth are a little more yellow, and now they're bright and sparkly white and beauteous.
I have your before and after shade here. You did great with the procedure.
Thank you.
I hope you're happy with your results.
I'm very happy.
You went from 030, which was your starting shade, which was on the relatively low end of the shade scale. Let me show you this here. Your before shade was here. It goes right in that tab. We go dark to light here. This is a new tab here that the manufacturer added called bleaching, because a lot of patients are bleaching now. And we got you down into the bleaching shade tab, which is 040. So you lighten up a few shades. Putting them side by side. Side by side comparison, you can see
look at that.
You can see the result there. If you put your head back here for me, please. This is where you started when you walked in. And the 040, I think, is a good match as to where you are now. So we lighten up, we got you down. After the whitening procedure, your teeth can lighten minimally, possibly another shade. Over the next 24 hours, they can continue to lighten up a little bit more.
Okay.
We have for you to go home with here post-operative whitening instructions. Basically what that card says is you want to avoid things that can stain for up to 48 hours.
Okay.
Tea, coffee, fruit juices, those type of things, sodas.
All right, so for Italians, my mom makes pasta pretty much every night. Sauce, macaroni, meatballs, all that stuff's no good. Red sauce. Stay away.
Red sauce you want to stay away from. Maybe you want to go with like a white sauce or something like that. No red wine tonight. White wine would be better.
All right.
You know, that kind of stuff.
Okay.
A cream sauce would be good, or probably maybe a pesto.
Okay. Delicious.
As far as any post-operative sensitivity, you can try Advil, stuff like that.
Okay.
It can last up to tomorrow, usually within the first 24 hours. By the following day, it's 100% gone. Once your enamel becomes rehydrated, and you'll be in good shape.
All right, great.
Alrighty.
So that is it. Cake. It's easy. There you go. 1, 2, 3. Zoom whitening, and look at these sparkly whites. Thank you, Dr. Steiner.
Thank you, Nina.
Pleasure meeting you.
Nice meeting you.
Kathy, thank you
Take
so
care.
much.
All right. Enjoy.